Welcome, everyone. Good morning again. I'm Shwetambri, your host, your dost, your trainer, and all of that. I'm sure some of you know me, some of you probably don't, and we're probably meeting the first time. But I'm going to be kind of, moderating the session. Yeah, before that, I will, say a few things about the doc himself, and then we shall, proceed. Understanding, first of all, what chiropractic means, right? A lot of people, a lot of us, especially in India, still haven't heard of the concept of chiropractor, right? And then we talk about spine health, and of course, the importance of it in general fitness and just to live a good life, and of course, fat loss as well. And we have a special guest today, which is Dr. Pratap. I'm not even going to say the second name. Doc, you can say it yourself. I don't want to mess up.
Yeah,
But
Dr. Prathap Adagitala. That's how
yeah,
it sounds.
I've known Doc for so long, and I still don't think I can pronounce his second name very well, so I don't want to mess up. But yeah, I mean, I think Dr. Pratap, more than being, a doctor, I mean, I go to him. I've been going to him for years now, probably a little over 6, 7 years, Doc.
Yeah,
Yeah.
pretty close.
Yeah, but I think more than that, we're great friends, right? We're good friends. We don't meet as often as we would like to because I think all of our work is crazy. But I've known him long enough, and I've known him when he kick-started his practice in Bangalore and how big he is today. He's, by the way, born, raised in Canada. You studied. I think you can talk a little bit about that as
Yeah,
well.
absolutely.
But yeah, he's born and raised in Canada, and finally, after he finished all his studies, he decided to come to India to start his practice and really spread this knowledge of what chiropractor means and what it can do to people and how it can help. Because obviously in India you don't see too many chiropractors, right? And I've been going to him for a while, and honestly, of course, I keep myself fit. I exercise often, but seeing Dr. Pratap once a month or something just helps my spine a lot more. And of course, I love the fact that he's so positive and motivating, and he keeps telling me, Shway, you have a spine of a 19-year-old. So that makes me happy. Then I go with heavier. But yeah, but Doc, I think over to you. You should definitely give a little bit of an intro about yourself to our
Sure.
amazing members right here.
First of all, just wanted to say good morning to everybody, and thanks for joining us on a Saturday. It's really great to be here. I'm super, super excited to answer all of your questions. And of course, thank you so much for the lovely intro, Shway. Shwetambri and I, as she mentioned, she goes back, yeah, basically from my roots. When I first started here in Bangalore, it was because of Shwetambri that I am where I am. So no, I'm not even going to be shy about sharing that because literally due to her auspices and her good grace, I was able to, get a foothold in the industry and really start to push forward. And we are where we are now. So my name is Dr. Prathap Adagitala. I am a chiropractor and I am the director of Atlas Chiropractic and Wellness. I'm also the head of chiropractic here. We have 4 clinics. 3 of them are in Bangalore, and 1 of them is in Chennai. That's our newest one. We hope to continue to expand and see more and more people and give people the benefit of, getting chiropractic treatment. So chiropractic is super simple. It's not difficult to understand. Basically, the idea is that your spine is kind of like your teeth, right? It requires maintenance. We don't think about it that way, but it is. Our spine is a chain of a number of bones, and the associated bones have these things called discs in between them, and that's something that people injure often. But the most important part about the spine is that it houses something called the spinal cord. The bony column, it acts like an armor for something called the spinal cord. And the spinal cord is directly attached to our brain. So if I even want to go like this, my brain has to send the signal down through my spinal cord, out through a nerve into the muscle that says, okay, finger, go like that. All right. So that's how simple the brain and the nervous system is. It's very sensitive, and having good spinal mechanics can influence how well your body functions. So chiropractors are basically your spinal mechanics. We are here to make sure and ensure that your spine is running optimally. And if your spine is running optimally, so is your nervous system. And your nervous system is the central control for all of your body's functions.
Yeah, yeah. Okay, that that whole nervous system part is obviously, it kind of really opens you up, right? Like, okay, you don't know that there is a connection of that sort. So I think
Right.
that's a huge takeaway right at the beginning, right there. But Doc, I just want to quickly, before I start taking questions, right? Just help people understand, like, what do you do as a chiropractor, right? I know, see, we all know that when you go to, like, in general, like an orthopedic, so on and so forth, the process, right? And I know when I come to you, you're literally like breaking me and cracking me and things like that. It's very different, right? The whole experience of going to a chiropractor, feeling that release is very different, right? So would you just quickly just touch upon what is it? Why is it so different?
Absolutely. So, chiropractic is centered around something called the chiropractic adjustment. So, that is more or less manipulation of the spine. So, if your spine isn't in a correct alignment, getting an adjustment from a chiropractor can really help to reset that. Now, what we use is I mean, there are over 200 different techniques that chiropractors use. In our centers, we use something called diversified technique, and that is the manual correction of the spine. So we use our hands, we assess for movement, we look for restrictions. If there are any restrictions, we can correct them using a gentle force through the joint. We can decide whether the joint has been rotated, if it's bent forward, if it's bent backwards, if it's moved to the side, one side or the other. And this can happen. And most of the people who are signed on right now, they're all people who exercise, and maybe they're desk people, maybe they exercise once a week, maybe they exercise 5 times a week. But all of these things can create misalignments. So what we do is we help by correcting those misalignments and using our hands. You may hear a crack, you may hear clicking sounds, and those are all fine. Those sounds are super, super normal. By doing that, we help to reestablish good range of motion. We improve your flexibility. We reduce pain if there happens to be pain. And other really important effects include recovery time shortening. So if you're sore after your workouts, getting adjusted on a semi-regular basis can help reduce your recovery. And other things like for people who are more higher end athletes, it can help you improve your reaction speed. It can help you have short bursts of extra power when you are lifting, things like that. So the difference between, I would say, chiropractic and another popular form like physiotherapy is that the manipulation of the spine is what we've trained 4 years post-grad to become experts at.
Yeah, yeah, yeah. I mean, I remember how you spoke about alignment, right? And
Right.
just something that I thought of, like, all of us, like you said, the way we sit, sometimes the way we stand, put more emphasis on one side. I
Crossing the
think
legs.
these, yeah, crossing the legs. These are the things that cause the misalignment, right? Apart from other activities that you do, even the very basic things that you do on a daily basis can cause alignment miss in the spine. So it's not like only people who are doing certain type of activity have these kind of misalignment. It happens to everyone, correct?
Correct.
Yeah,
Correct. Absolutely.
yeah. So I'm
So,
just,
mm,
yeah,
yeah,
yes, doc.
go ahead.
No, 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 I had a lot of questions, so I was going to start taking questions, but you had a point.
No, yeah, it's just that you touched on it lightly, and that's it doesn't necessarily have to come from impact or trauma. You didn't have to fall somewhere by accident. You didn't have to be on a long flight to have that misalignment. Just regular stuff. We touch on it, like crossing your legs while you're sitting, even sitting cross-legged can come sometimes create a misalignment in your spine. Definitely posture in front of the desk. Definitely things like how you're looking at your phone, how your ergonomics are set up, all of those things, very, 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 very minor things that you would think that, oh, it's just an everyday thing, not a big deal.
Yeah.
Over time, it will accumulate and create that stress in your spine. And relieving that stress in your spine can really, really change a lot, including even minor things that you thought were not fixable.
Correct, correct. So I'm going to start taking questions, but
Yes, please.
I have to talk to, in the end, I definitely want to tell everybody about the whole connection of strength training, muscle mass to spine health, because
Go for
I've had a personal experience with it. You know, when I had that fall,
it.
doc, when I came to you, if I
Absolutely.
hadn't really had that muscle, mass that I do, I think I
Yes.
would have probably broken my spine at that point. But I'll talk about it later. I want to start the first question with, a lot of us have these small niggles, lower
Mhm.
back, mid back, and etc. And we kind of start ignoring it for the first, few weeks, few months, sometimes even over a year or two, right?
Mhm.
Until it really flares up and it comes to a point where we probably cannot move, and then we obviously rush to the doc because there is no choice. So I just want you to throw some light here that when we have these little niggles, is it too soon to go and see a doc, or do you have to, like, is there like a particular time that is the right time to go and see a doc?
Yeah. So there's no threshold that's too big or too small. Okay. So there's not like you don't have to cross a certain, barrier before you said, yeah, okay, now I have to go get it checked out. My recommendation is that, well, I mean, I'm kind of biased on this, but if you have any kind of sort of niggle or something that you haven't experienced before, or maybe it is a recurring niggle, like, yeah, I get this from time to time. It's not a big deal. It knocks me out for 3 or 4 days, but then I'm fine. Like, you should definitely get those things checked. A small thing that you could perceive that, oh, it's not a big deal, could become a big deal.
Yeah,
Um,
exactly.
the accumulation of stress, like I said, can lead to tons and tons of problems. And I really would prefer if you sought help early than late. Remember that a lot of pain doesn't necessarily require painkillers, right? Pain always has a source. Pain is actually a symptom. A lot of times people come in here and like, my pain, my pain, my pain. And it's like, yeah, I get it. You have pain, and that's something that we will want to work on. But if we only work on pain, the cause of the pain kind of sticks around. So the goal of chiropractic is also to treat the cause of your pain and not just relieve the painful symptom.
Yeah, exactly. Yeah, I wanted to touch upon that because I'm telling you, a lot of us who work out on a regular basis, who are active or probably not active at all, right, deal with these little pains, and we kind of tend to ignore it, saying that, okay, it kind of goes away in 2, 3 days. But I
Yeah.
personally always felt that if you kind of, there's always a reason why you have pain, right? Typically, your body can avoid as much pain as possible. You're supposed to have pain-free movement. But if there is some sort of pain, then there is a root cause to it, and it's always good to identify. So it's just
Right.
something that I wanted to start off with so that everyone realizes that pain as such is not such a normal thing to deal with, right?
Absolutely.
Okay, so taking a question, someone's asking for sciatica, will seeing a chiropractor help?
Sciatica is one of the most common symptoms that we see on a day to day, week to week, month to month basis. Chiropractic is excellent for sciatica. And the thing is, the thing that people don't understand about sciatica is that it's actually not a diagnosis. You don't have sciatica like you have, I don't know, rheumatoid arthritis or you have a slip disc. It's not a diagnosis. It's a symptom, kind of like saying headache. Sciatica tells us that you have pain that starts maybe somewhere around your low back and runs a certain distance through your leg. So typically speaking, the back of your leg. So if
Yeah.
you have pain on the front of your leg, it's not sciatica. If you have pain on the side of your leg, it's usually not sciatica. If you have pain on the back of your leg, it's sciatica, but it doesn't tell us why you have sciatica. Now, sciatica has pretty much like two or three main causes, starting at the bottom. So sometimes people suggest that it's a muscle. So we have a muscle around our bum. It's called the piriformis, and it's not. It works like a belt. It's kind of a restriction, rotational based muscle. It helps to restrict the movement of our hip, and it's actually a very important muscle for hip rotation. Sometimes that muscle can get too tight and the sciatic nerve runs below the piriformis. And so sometimes people get diagnosed with something called piriformis syndrome. Simple stretching of the piriformis should really help with sciatica, but typically speaking, just stretching doesn't relieve the sciatica. Otherwise, nobody would have it.
Yeah.
The most common reason for sciatica is a disc bulge. There is, we touched on it earlier, but part of the anatomy of the spine includes something called a disc. And the disc, if it protrudes outside of its normal boundary, will put pressure on something called a nerve root. Sciatica refers to the sciatic nerve, and the sciatic nerve is the largest nerve in the whole body. It starts in the pelvis and it runs all the way down the back of the leg. It's huge. I've seen it in a cadaver, and it's enormous. It's got a huge caliber, and it starts from nerve roots in the spine. So if the disc is putting pressure on a nerve root in the spine, that's actually the cause of your sciatica. It's not from your leg. So getting it diagnosed correctly is really important.
But I like the fact that you said that it is a symptom, right? It's not the main problem by itself. It's a
No,
symptom for
it's not.
some other disc
Correct.
issue that is, yeah. So I hope that
Wait, I don't have the data on this exactly, but I can say that probably I'm very close to 8 to 9 out of 10 people are having sciatica based on disc bulges, pressure on a nerve.
wow. Is it because of the type of activity or sedentary lifestyle? What do you
WFH.
work from home?
It's not WTH anymore. It's WFH. But what the heck? Work from home is killing everybody. It's just the uncommon positions, the length of time. I know that companies are really loading up on people to make sure that they're doing work. So their 8-hour schedule that they would normally punch in, punch out at the office has become 12, 15 hours. And typically speaking, people are not having the correct setup at home. They don't have an ergonomic chair. They don't have a desk. They're working from their bed. They're working from their dining room table. They're working from their couch or a beanbag. And it is absolute mayhem out there for the discs. Guys, I mean, this is something that I see every single day, 20 or 30, or sometimes even 40 times a day. It happens. So, get out of your chair. We'll touch on this. I'm sure we're going to get to this, but I have a ton of regular tips and tricks to avoid this issue.
Yeah.
But one of the most important ones is get yourself a chair and get yourself a desk. That's the only way to do this. You can get a standing desk. You can be fancy about it. It's all good, but just make sure that you're not sitting from your bed and working. This is one of the worst ways you can work and one of the easiest ways you can damage your spine.
Wow. Okay. I'm glad I don't work out on my couch, my regular couch or bed, but I definitely don't sit on the perfect chair. So, yeah, thank you for reminding me and everybody here that this is work from home conditions can be dangerous for us. Fine. Thanks, Doc. I think that really was needed. Okay, so here's another question. Priyanka asks about what precautions should dentists take because they have to bend and it's not like a proper bend, right? It's like the partial one. So she wants to know what sort of precaution can dentists take?
And depending on the procedure, you can be stuck there for quite a while, right? And it's a very small area that you're going to be looking into. I have tons of dentists that are both friends and clients. So the truth of the matter is, excuse me, you're in a tough spot because your work requires that particular position. My only recommendation is to outside of seeking care from me and maybe another chiropractor or whatever it is, getting regular adjustments really would help. But outside of treatment from chiropractic, getting into a stretching routine, making sure that when you're off the clock, that you are paying attention to your posture, you are paying attention to your spine, you're giving your spine the TLC it requires. So even if you are working out, I'm glad most of the people who are here are working out on a regular basis. So good. That's a huge impactful thing that you can do for your health, but make sure you're spending the time for your recovery. So stretching, whether it's a hot pack or a cold pack or, hot shower, sauna, steam, whatever it is, get yourself into a recovery routine so that you can have a longer career. Otherwise it's going to be a pretty painful, 20-year hike. It'd be pretty painful. But that
Yeah.
being said, it is fixable. It is something that you do need to pay attention to, especially when you're off the clock. Perhaps between patients, you do a little minor stretch. You have to pay attention specifically to your lower back and to your neck.
Lower back and neck, particularly, right?
Absolutely.
Stretching lower back and neck can help between patients. Yeah.
Absolutely.
Yeah. So then there's a question. After COVID, my back pain has increased tremendously.
Mhm.
Would, seeing a chiropractor help in such cases, or what else can be done?
We're seeing a ton of recovered COVID patients. I'm sorry you had to go through that. It is, it's one of those things. We're kind of rolling through a pandemic here, so we're happy that you're here. We're happy that you're feeling better. But with all the coughing and all the tightness in the lungs, the rib spaces, as well as the thoracic spine, the middle part of your back, those are going to be taking a bit of a beating, so to speak, because it's not moving freely like it normally would. A lot of the time, people who have impaired breathing develop something called scar tissue in between the ribs and through the thoracic spine. So the COVID patients who have recovered and have come to see us, they're all reporting about the same thing. And adjusting the spine does really help. And I'm talking about all age groups. There has been a marked improvement in their breathing and their ability to feel more flexible through the spine. There are going to be exercises that we will prescribe, and that's going to be a common mantra. You're going to hear me say this often through this interview, through this live. You're going to be hearing me say, okay, exercise. Yeah, it's true. But which exercises you do is really key. Okay. So outside of getting adjusted, if you feel comfortable and if your body is able to do it, doing some light thoracic mobility stuff, especially like maybe over a foam roll or something like that, something safe, something easy, something that your body can manage, those things would really help.
Yeah. So basically you're saying focus on, thoracic mobility drills, right?
Absolutely. Remember, COVID is a nasty one, okay, and it does impair quite a bit of things. And when you're when you're being beaten down by it, it's you have to take as much rest as you can. And just laying around in bed, you think that, okay, I'm taking full rest. That's also painful for your spine because it wants to move. So being restricted in its movement can also create that stiffness. So I hear you, and I feel bad for you, but it's fixable. Don't worry.
Yeah, and would you also then advise? I know a lot of people already know, but after you recover, give yourself a month or probably even more than that before you start exercising again, like before.
Correct. You got to
Yeah.
ramp up really carefully. It is a situation that, like, your body, it's unprecedented. Your body is not used to that type of thing. So giving yourself the time in order to do it. Like, I mean, very few of us have these rigid goals. We're not trying to, be in a bodybuilding competition next month. Like, there's no finish line, guys. There's and even if you get to your goal, there's another goal that's going to start very soon after that. So it's a shifting target. I want you guys to think about it that way. There's no rush to get to where you need to go. Oh, I want to work out. I want to work out. That's part of my lifestyle. It's part of my mentality, my personality. I get it completely. I get it. It's just one of those things that if you rush into things, you tend to actually create a lot of delay in where you want to go on your goals. So take it slow and you will reach your goals, promise.
Yeah. Now, one of the problems that I hear very often, and a couple of, not couple, quite a few questions around this is I have lower back pain, for a very long time, and someone is talking about having it over a decade.
Right.
I suffer from, cervical and knee pain, and I typically struggle, with doing squats and crunches and things like that. When a lot of people talk to me about, like particularly a joint pain, like, their knee is hurting, only the knee and stuff, I normally also tell them to, get a blood test done to see where their vitamin D, calcium, all of these levels are, because that also can deteriorate your bone health, right? But this thing where a lot of people are suffering from, cervical knee pain, I'm sure you're going to tell us that how there is a connection and the fact that they're not able to do squats and lunges. So
Yeah. So one of the major things about knees that you're not really probably paying attention to is your body's weight. 1 kg on the body is 4 kgs on the knee.
oh, wow.
So if you're sitting here 10 kgs overweight, and maybe you put on the work from home 10 kgs that everybody's walking around with, that's 40 extra kgs on your knees. Okay.
Wow.
So, I mean, I'm seeing this a lot with, like, especially people's parents. People come in to see me for back pain or neck pain, and then they're like, oh, well, can you help me with my mom's knee and this and that? And the answer is true. I can. But if you're noticing that your relatives, or maybe even yourself, is having knee pain, oh, I'm walking, I'm straightening, I'm trying to get out of a chair and my knee hurts, or it clicks and it cracks. Those are check the weight. That's one of the things that I always recommend. And this kind of really blends into our talk today about fat loss, right? And see, it's kind of a catch 22, I have pain, so I cannot exercise, and I cannot lose weight because I cannot exercise, like
Mm.
it goes around and around. I get it, but you have to interrupt that cycle somewhere. So if it hurts when you walk for 5 minutes, at least walk for 5 minutes, right? Take a
Mm.
rest and continue. One of the best things for knee pain is basically, walking around in a swimming pool. Now, a swimming pool, it will help you stay buoyant. It'll take pressure off of your joints, especially something like your knees. But again, with COVID, it's hard to find a pool that's open now, right? So I get it. There are ways around this, and it's just a matter of figuring out, well, why is your knee hurting? One of the major things, especially when we get to older age, is the space in the knee. So the knee has basically two major bones, okay? And the space between the bones should be even all the way through. And what happens is over time, with especially something called osteoarthritis, is that the space between the bones narrows. Okay. Now, if the bone is sitting on the bone like this, even simple bending becomes really painful, right? So I usually, like, especially if it's an older person, I generally recommend an x-ray of the knees in three different views. And then we can have an understanding of, okay, well, is it bone on bone and is it not? That leads us to a separate question. This is kind of a rabbit hole. I'm sorry for this, but if there is bone on bone and the person is a little bit older, then my recommendation is usually do some exercise, some strengthening exercise with our physios first, get that muscle mass a little bit stronger so the recovery is a little bit shorter. Surgery is usually the case in this case, and total knee replacements have become super common, so it's not a major issue. It's a pretty simple day of procedure, and it doesn't require much thinking. It's a simple procedure, but the recovery is something that does need to happen immediately after the surgery.
Yeah, but what is it in the younger cases? Like a lot of the young, like I
Oh,
was saying,
yeah,
25,
absolutely.
30,
In, in
35.
in the in the younger cases, it's usually a situation of sitting for too long,
Mm.
or a situation where the seat that you're sitting on is not adequate. Either
Mm.
you're sitting cross-legged half of the day, so that's going to put a lot of like extra flexion into the knee. The knee's not meant to do that for so long. The other
Oh.
thing is that how you're sitting on your chair. So imagine this is your knee.
Mm.
Imagine this is your chair, right? If the chair cushion is sitting right up underneath your knee, it's going to put a lot of pressure on your knee. Okay.
Oh,
So you'll want a little bit of gap. So where your knee is bending, it shouldn't be stuck against that cushion.
got it.
Okay.
Got it.
So a lot of people who are sitting on dining chairs or whatever, that cushion is pressing right up underneath their knee, and that's what they're getting knee pain from. Um,
That's it.
crossing your leg is another big one. So try to avoid all those things where that would create a little bit of imbalance in your pelvis.
Got it. That sitting part is very interesting because I realize when we sit on our office chairs, you're actually, the knee joint is not right at the chair. It's a little
Correct.
ahead. It's a lot more
Correct.
comfortable. But when you're sitting on these high chairs and those kind of chairs, it's right. Okay, that's a great takeaway. Thanks so much.
There's one more thing about the knees, guys, and that is strengthening the quads will really help you with all those little clicking things that are going on right now. So doing your squats, doing your lunges is important. And you don't have to do ass to grass squats, excuse the language. You don't have to get all the way down into your squat in order to get benefit. Even a 90-degree squat is fine. So for the person who asked the question about neck pain and knee pain, I'm unable to do squats and lunges. First of all, definitely check out for any osteoarthritic changes in the knees. And if it's not osteoarthritic and it's not something where the knee joint itself is hampered, definitely start looking at building strength in the quads. There's a lot of different exercises you can do for that. And if you need additional help, come see us.
Yeah, yeah. I think the point where you mentioned that weight itself is the first reason, right? If you're on the heavier side is very interesting because I know of a lot of women particularly who are on the heavier side and who are dealing with knee pain, who literally say no to exercise because they don't want to deal with that pain, right? But like you said, even 5 minutes or 8 minutes or 10 minutes of movement every day and dropping that weight little, every week, every month, I think can get you to a very comfortable space and probably remove that additional weight off the knee, right?
Wait,
So
there's one more thing that I wanted to throw in there, and that is like I mean this percentage varies from practitioner to practitioner, but I'm in that 30-70 range. So your weight loss is 70% in the kitchen. Okay.
yeah,
So a lot of people are like, no, I eat a very small amount. I can't lose any weight. I have a thyroid issue. I have this, I have that. And it's like all the reasons why they cannot lose weight. But I didn't hear anything about vegetables. I didn't hear anything about reducing sugars. I didn't hear anything about, those small changes that you can make on your daily diet.
yeah,
These are things that you can do to lose weight. Like we're talking about 100 grams in a week.
yeah.
That's not
100
that
grams
much.
is totally possible.
It's not that
Totally
much.
possible. Yeah,
Yeah.
yeah, I agree. I think that's a great message, for everyone who feels like, okay, they're on the overweight side and now it's time to lose that additional weight to, protect your knee. Look at 100 grams a week, maybe, right?
Yeah,
It is possible. Yeah, I
it
can
is.
promise you that much. It's possible, right? There's one interesting question here. What tests are recommended to proactively test if you are heading into a spine issue? And the
Mm-hmm.
frequency of such tests.
Mm-hmm. Mm-hmm. Okay, so interesting question because it's not like a blood test. We can't go and
Yeah,
go check your parameters and say, okay, yeah, my calcium is low and therefore I'm going to have osteoporosis. It's not really quite like that.
yeah,
Our bone density actually improves with pressure. So that's how we grow. Actually, kids who are active tend to have stronger bone density and they have longer bones. So bone health and bone growth actually happens along planes of pressure. So if you are working out, you are doing exercise, you are doing things on a regular basis, that's a really healthy thing to do. If you have some sort of a routine that you do for exercise, for your back, for your neck, for your, whatever it is, stretching and movement, mobility, that's something that I definitely recommend. There is no test as such, but I would say, and again, this is going to sound really corny, but come and see a chiropractor because that's what we do. It's not just people who have pain. This is the part of our practice called wellness. That's why we are Atlas Chiropractic and Wellness. It's not just about people who are in pain. It is also about how you can maintain a healthy, active lifestyle. It's also how you can stay in good shape. So managing that is super easy to do. Come in, get an assessment done. We can check your posture. We can check orthopedically if there's anything going on. We can check physically with our hands and see if, hey, is anything going on here? And if required, we can also take an x-ray or an MRI or anything that's required after that and say, hey, look, here's what your spine looks like. We expect this to happen. Here's how you change your lifestyle bit by bit to prevent any further pressures and damage from occurring. So
yeah,
actually a really easy fix. I have a bunch of wellness patients who come in once a month to once in 3 months, once in 6 months, like that, just to say, hey, doc, how's my spine look?
yeah, yeah. I do that. I do
Exactly.
that once in a while. Like, hey, yeah, let me check how my spine health is because I've been lifting quite a bit. Okay.
19-year-old spine.
Do calcium supplements help spine health?
Calcium supplements are decent. I've recently wrote an article about the top, supplements that you can take, and calcium doesn't fit in that top supplement category. It's okay. It's usually overprescribed. Now, the one group of people who can benefit a lot from calcium are the people who are entering menopause.
Mm.
Because see, menopause, as you're going through the hormonal changes, it actually leaches calcium from your bones, so you do end up with some bone density loss. Actively supplementing with calcium is required, but also don't forget about your D3 because you cannot use the calcium in your blood without D3. It's like a cofactor. In order for your calcium to be absorbed into your bones or other structures, you need a healthy amount of D3. It's one of those weird biochemical things, but you definitely need to supplement with both. Another close additive is magnesium. Getting magnesium into is also a really beneficial thing for bone density.
Yeah, okay, got it. What are the precautions to take to avoid lower back pain? What's the
Oh God.
best treatment? I mean, I know that's tricky, right? Because what Vishal is saying that I've seen many docs, but then the pain relief is very temporary. Like, how do I look at getting rid of this lower back pain and making it stronger again forever?
This typically is a situation of mechanics. Okay. If you are, okay, I always talk about this with my patients. There are 168 hours per week. Okay. If you're doing something, let's say you're getting a massage 1 hour every month, you know, do that math, right? It's a drop in a bucket. In other words, it's inconsequential. If you're sitting, okay, let's take out 8 hours for sleep. You should be sleeping on average between 6 and 8 hours. So that's where we get our recovery. So if you're not sleeping well, that's one of the reasons why your pain never goes away. The
Right.
other thing, the other thing that I can recommend here is, again, if you're sitting for 8+ hours a day, your chances of low back pain are skyrocketing. Not only that, your cardiovascular health is also going to take a beating. There is a stat: every 8 hours of sitting, it nullifies 70% of your 1 hour workout. So let's say you guys
Oh
are
Lord.
doing a let's say you're doing a cult fit class 1 hour a day, but you're sitting on your butt the rest of the day. Guess what? You've only done 18 minutes of cult fit. So this is something that you need to really, really look at. And getting off your butt is one of the ways you can fix your back pain. Okay, guys. I recommend every 30 minutes, 1 minute of standing. Okay.
Okay.
Every 30 minutes. I don't care if you're in a meeting. Here, I'll show you what I mean. Okay. Right now, me and Shui have been on this call for about a half an hour. Here's what I'm going to do. Did it disturb anybody? Nope, it did not.
Okay.
Okay.
I speak as well.
All right. So you can stand for a minute. Nobody's going to be affected. And now I'm putting my laptop back down. Okay. And I'm going to sit back down. That's it. That's how easy it gets. All right. So what was the name of the Vishal?
Vishal, yeah.
Yeah. So Vishal, man, if you're having back pain on a regular basis, you're not stretching, you're not getting out of your chair, you're not doing the strengthening exercises, you are prone to bending forward, or you're sitting in a improper ergonomic setup, you're going to have back pain. Okay. You have to change some lifestyle elements if you want to be free of back pain forever. And I touched on this way long ago. And I tend to be a little long-winded, but it's just one of those things. Like, if you are looking for change, it starts from you, right? If you're doing the same thing over and over again and expecting different results, that's the definition of insanity. It doesn't work. Okay. Medicines. Okay. Here's another thing. A lot of times people go to an ortho for back pain, and it's a mechanical problem. Okay. So now you have a mechanical problem. You're sitting for too long. Your back is starting to compress, and the joints and the bones and the muscles are getting weaker and weaker, and they're starting to become more painful. And you're taking painkillers for this. Now you have a mechanical problem, and now you're taking a chemical solution. Where's the beef? It doesn't work like that. You need a mechanical solution for a mechanical problem. That's what chiropractic offers. But on the other hand, the chemical solution is going to have tons and tons of side effects. So if you have an accumulation of painkillers into your system, your stomach is going to go for a toss. Your digestive system is going to go for a toss. Your nerves, your muscles, everything gets really, really, really dependent on those painkillers. Painkillers are addictive, and yeah, everything after that is just downhill. So watch out.
Yeah. What do you think of massage for pain relief?
I like massage. Massage is great. I think it's one of those things where, a lot of the time we like that feel of, oh, okay, somebody is rubbing our muscles. There's oil. There's maybe some warmth with it. There is also a serotonin release, a dopamine release. Our mind feels good. It's relaxing. We're doing something outside of what we normally would do. I think a massage is a healthy part of any recovery or any type of wellness plan that you have for yourself. Just be careful, right? Like, not every massage therapist is trained. Not every massage is going to be useful for your particular condition.
Yeah.
If it's something that's like, okay, so massage therapy in India is not regulated, so anybody can do massage and charge you for it. Just watch out.
Yeah. Varun has a question is, I have a severe tendency of developing knots, right? Like muscle knots
Mhm.
on my traps. And the
Mhm.
usual trigger points at cervical spine, right?
Mhm.
And he's been seeing, like, physio services, chiropractor, all of that for the last 6 years. He's like, what, according to you, is the best way to keep these irritating knots away from the body?
Number one is your posture. Keeping your posture good is really, really important. So now a lot of people, they tend to have this, forward head and rounded shoulder appearance. So that already is starting to tweak my traps right here. Now, another thing is if I'm using a mouse, I'm gonna back up a little bit. Maybe you guys can see a little bit more.
Yeah,
Yeah.
I think it's
Okay.
better.
So if I'm using my mouse, right? And I'm using my mouse and it's all the way the heck out here. Well, guess what muscle is being used? It's my trap. Get the microphone out of the way. Right. So if my arm is elevated, my elbow is up, my trap is activated. So if I'm holding my mouse with my arm out, that's going to overstimulate my trap. Okay. Now, the key for this is then bringing your elbow nice and close to your body when you're using your mouse. Okay. This is not required. This is. Okay. Now my trap is nice and relaxed and it's not overused. All right. So that's something that you can look out for. Also, so this point, okay, I don't know if you can see this. There's these collarbones here. Okay. The two collarbones. There's a space right in the middle of this little hollow.
Yeah.
Okay. I want you to point that directly in front of you whenever you're standing, sitting, or walking. See, typically people are bent over like this. So this actually points down towards the floor. But if I just level this off and I point it directly in front of me, now my traps are in a much more level position and my posture is much better. Okay. So I want you to think about those things. The other thing,
Why did you say this in particular? Like, is that some connection or is it like for us to keep in mind?
not, those laser levelers. I don't know if anybody does any construction projects on their own, but like it helps you kind of keep things nice. It'll tell you what a straight line is.
Right.
It's a light, so it'll be traveling in a straight line. So I was just saying, like, for me in my mind, as a mental hack, it just kind of helps me level up my chest. The other thing is that most people tend to cave in their chest. They sink their chest down when they're shrugging forward and they're working forward like this. So I'm saying this point here can help you elevate your chest and kind of improve that shoulder mobility and keep your posture in better condition.
Got it.
The other thing is that if you're doing a lot of shrugs, if you're doing a lot of shoulder work, a lot of overhead presses, you're going to develop those trigger points, and that's not necessarily a bad thing. It is annoying, but it is something that will happen. The trapeze, like the upper trap, the trapezius has 3 layers. The upper trap, which is the most common, it has the most common trigger points in the whole world. So if you have trigger points in your traps, join the club.
Yeah, but I think a regular, like proper stretching and even maybe foam rolling and releasing those knots can help, right? At home.
Absolutely.
Yeah.
Absolutely. Trigger
Yeah.
points are normal. Trigger points are like a really common condition. It's not a condition. It's just a feature of your muscles. Trigger
Got it.
points are basically just tight bands within a muscle. The muscle is made up of layers of fibers, and sometimes those fibers don't slide smoothly across, and that's what a trigger point is. Like a little, like, you're walking by something wearing a nice sweater and it catches on something and suddenly you get a run because the thread pulls. That's more or less what a trigger point is.
Yeah.
So just organizing the muscles, doing some stretching, doing some massage, doing some mobility work should really help.
Got it. Dr. Pratap, appreciate if you can give a few tips on recovering from L1 spinal fracture. I had
Ooh,
spinal injury 3 years back, but I still get pain if I kind
yeah.
of stretch.
So typically speaking, a spinal fracture at L1 would have been caused by a fall, like a thump on the butt or something like that, where you sat down suddenly, or you just landed on it. Usually, a fracture of that nature is a compression fracture, and that's a really tough one. The best thing you can do in this position is where the pain starts to elevate, just take a bit of rest, but also developing your core muscles, trying to do as much as you can to build your core. If you find that regular crunches and like things like that are painful where you're compressing it, try things like planks, dynamic stuff where you can, stretch as well as strengthen. Those are some things that I may recommend for you. The typical situation where it comes to wedge fractures is that where a bone should be nice and square, it tends to become more triangular. Okay. And that can lead to actual change in the way your spine functions at that level. So it's not an easy recovery tip that I could say. Each case is a little different, but if I was to be very, very general about it, I would say start to develop your core in a safe and corrective manner, and try to get out of your chair more frequently.
core strength, core strength, core strength. I remember I went like crazy focusing on core strength in our belly burn program. You remember, Doc, I was
Ah,
talking about it, the one that got launched in June, right? So,
I've
and
been seeing
I
the
was so
updates.
happy that a lot of members after completing it reached out saying how they could feel the core, really getting stronger. A lot of things that they did, they felt so different. And personally, I think my realization of how important it is to strengthen core, one is of course post that spine, that injury that I had, and then not
Sure.
spine but that fall. Second is of course postpartum, right? Because that's when you realize how your core takes a beating. But yeah,
Absolutely.
core strength. Any suggestions for desk job people? I think you already kind of went over it, saying the right setup, which is the right chair, the right table, and what else do you every 30 minutes get up for a minute, walk around, or
Absolutely. So just to quickly go over the ergonomics 101,
yeah.
your feet should be planted on the floor. Your ankles should be at 90 degrees. Okay. So no, I don't like when people cross their feet under the chair. I don't like when they extend their legs out in front of them. Don't drape your leg over the handrest of your chair, things like that. Okay. So keep your feet flat on the floor. Keep your butt all the way into your chair. Okay. A lot of times people, they sit halfway onto their chair and then slouch. I want you to use your chair for its ergonomic advantages. Stick your butt all the way back in your chair and use the back support. Um, your ankle should be at 90 degrees. Your knees should be at 90 degrees. So set your chair height so that your knees are not, overly like straight and they're not overly bent. Same thing with your hips. Your hips and your spine should be again at 90 degrees. Your screen should be at your eye level, and then your hands, they shouldn't be up. So I know a lot of people, they get these laptop, I don't know what they're called. They're called laptop stands. And they kind of angle the screen up, but then the keyboard is like up forward. Yeah, exactly, straight, just like that. So that's not really useful. My recommendation is always, use a Bluetooth keyboard if you're not getting that correction, and keep your elbows also at 90 degrees. So it's like you're kind of a box, but you're nice and upright. It's hard to maintain that for a long time. That's why I recommend just hop out of your chair in half an hour. You only have to maintain it for half an hour at a time.
Yeah. How much? That's another nice question I just saw. How much workout is good workout? In the sense, can spine also, can we hurt our spine if we kind of overdo the workout when we do too
Absolutely.
much activity?
It's a sliding scale. It's a gradient. So it is possible to do too little, and it is possible to do too much. Uh, you're going to be the best judge of this. Okay. If you feel like your body is breaking down after you've loaded yourself up quite a bit, then yeah, you should listen to your body. That's the like A1 principle. It's not a situation where like every pain you should be like, hey, no, no, I got to shut it down, got to shut it down. Muscle soreness is normal after workouts. I'm sure all of you have experienced this. So that sometimes you work out and you don't feel anything the day of, you don't feel anything the day after, but you feel it on the second day. And that's called DOMS, delayed onset muscle soreness. Okay. That's normal, super, super normal. Make sure you're staying hydrated. Make sure you have some recovery supplements like maybe a whey protein or something like that. And I'm sorry, I've drifted off course here. What was the question again?
It was about how much workout, is
Oh,
too
thank
much
you.
workout bad for the
Yeah.
spine?
No, it's again, if you're doing deadlifts, extremely heavy deadlifts like every single day, then yeah, that'd probably overwork your spine. But
Yeah.
if you're doing a normal, a varied program, you're doing some strength and conditioning, you're doing some cardio, you're doing some stretching, you're doing some core, you're doing some abs, all fine, no problem.
Yeah.
Even if you were to work 6, 7 days a week, it's okay, provided you're changing up your routine. It's not the same
Yeah.
routine day in, day out. It's not working the same muscles day in, day out. You can do what you need to do. It's fine to work out 7 days. It's also okay to take rest once in a while. Okay. It's okay to listen to your body. It's okay to say, hey, you know what? I need a break today. It's okay. But just remember that if you have a routine that you want to follow and you're aiming for specific goals and outcomes, you can afford to have a little buffer within that program. There's no finish line.
Yeah. Don't go heavy and intense every single day, right?
Well, even from that angle, like I'm okay if you lift heavy every day. It's fine. It's just you have to vary it so that you're not overworking the same groups of muscles and joints.
Yes. Got it. Got it. Yeah, like you said, don't just keep doing deadlift every other day, sorts. Yeah. Is there any way of doing a spinal self check? Like, something that you can do at home to understand if, you have like a decent, especially as we're aging and degeneration is happening. Is there any self check that can be done?
Yeah, absolutely. So, first of all, you can start with your neck and the regular ranges of motion. I can help you guys with the ranges of motion, like the degrees of motion that you should be looking for. But specifically with your neck, make sure you can turn your head all the way to the left and all the way to the right. You can look all the way up and you can look all the way down. And the most important one, you can bring your ear to your shoulder and you can bring your ear to your shoulder. If you can't do any of those things, or if there's something restricting you in any of those motions, you get looked at.
Oh,
It might be muscular, it might be joint. Okay. The
and
same thing can be said for your thoracic spine. So if you cross your arms, bending forward, turning to the side, turning to the side, leaning to the side, leaning to the side, right? Those are what we call, okay. So when we bend our head forward, that's called flexion. When we bend our head backwards, that's called extension. The same thing applies for the rest of our spine. You can do this for your neck, your mid spine, and your lumbar spine.
yeah, so when we stand and we bend, even that can be a test, right? Where we like the hinge at the hip.
Correct, exactly.
Yeah.
So when we talk about hip hinge, it's important to really stick your butt back.
Yeah.
Okay. A lot of times people, they start to bend from their lower back. That can create pressure. So if you find that just leaning forward is kind of pressure, maybe you're tying your shoelace, you're like, I gotta ease into this. There's probably something going on that you should be checking for. But the ranges of motion are your self checks. Okay. So left, right, turning, up, down, and then ear to shoulder, ear to shoulder. You can do that for your whole spine.
Got it. So if you struggle at any point, like if I'm looking to one side and I feel like, it's limiting my range because I can feel a little niggle, then that's
Right.
something to start thinking about. Like, okay, there
At,
is.
at, at least to be curious about, for sure.
Okay, okay. Rashmi's got this question. My brother has been diagnosed with lower back issues for the last 2 years. He's not able to walk much, mostly lying down. There is frequent unbearable pain, and he has to take painkiller most of the time. He has been walking and exercising now. Doctors say that recovery will be slow. Okay, it's very, very tricky. Like, I think,
Individual cases like this is really, really dependent on what the actual diagnosis is. I'm sure the diagnosis isn't just a general lower back issue. I'm sure that there is something going on with either a disc or a nerve or some functional element of the spine. So getting clear diagnosis would really help direct my advice for this. So
yeah.
having him do XYZ exercise won't really help in this case. I'd need to know more information. I'm sorry to be vague.
Yeah. Amita wants to know any good, like how to maintain good spine health, any nutritional tip on it.
Absolutely. So I actually, a lot of people have been asking me about like joint health supplements. One of the things that everybody should be taking, and again, I'm my blog is on Medium. You can find me on Medium. Somebody had asked earlier about like where they can find my supplement guide. So I get all of my supplement information from a website called examine.com. They're a really, really great source. If you have any questions about anything you might hear about in the news or via people, okay, try this or try that. This is good for you. This is good for you. Check it out first. Examine.com. It has all the research information out there about each thing, and it's condensed into very usable, readable information. So check it out. So I based a lot of my blog on information I got from that site. And Omega 3s, guys. Thank you, Rag. Omega 3 is one of the best things you can put into your body because it helps you. It helps you with not just joint health and glide, but it also helps you with your brain. It also helps you with fat metabolism. It helps you with the ability of your body to get rid of unnecessary fats. It helps with the whole, the HDL, LDL, cholesterol ratios. It's really, really quite good. Hair, that's a good one. Nails, you got it. So omega 3s are one of the best things you can take. I like to take omega 3s that are high in two essential fatty acids called DHA and EPA. Okay. I'll let you guys do the research on which brands and all that stuff, but Omega-3s are really great. And there are vegetarian omega-3s. It doesn't have to be fish oil. It doesn't have to be liquid that you take on a spoon, which is horrible. There are capsules and things like that. Exactly. So there's tons and tons and tons of ways you can get omega-3s into your body. And a lot of the time, omega-3s you're not going to get from your food. So it is okay to supplement with. That's
Yeah.
another really, really kind of easy key for fat loss. All right. Another thing that I recommend is glucosamine chondroitin. Glucosamine chondroitin is a biochemical that we already have in our body. And if you supplement with it, it just kind of goes towards the areas that need it, like your joints. So that's one of the things that I do recommend. Now, if you wanted to be a little bit more higher, like a little bit deeper in, maybe we can, every day is fine to use it. You can use it as directed on the supplement bottle. Again, like I said, a lot of these companies are actually combining them with a bunch of other joint things like HCl and like MSM. These are all like biochemicals that will help you with joint health. Boswellia is another anti-inflammatory agent that is a naturally occurring anti-inflammatory. Ashwagandha, I'm sure a lot of you guys have known about ashwagandha. You can go on and on and on with the supplements, spirulina and super greens and all those things. They all help to limit inflammation and things like that. But from a joint health perspective, my recommendation is omega-3s and glucosamine chondroitin.
Sure. I have a daughter 10 with scoliosis. Will this treatment help?
Scoliosis is the lateral curvature of the spine. When we look at someone's spine, it usually is straight, but when somebody has scoliosis, it kind of bends from left to right. And there are different degrees of scoliosis, and especially in younger people, scoliosis can be either debilitating or it can be something that requires orthopedic intervention, including surgical rods being put in. It could also include, bracing, depending on the degree of the curvature. Chiropractic, I have a bunch of scoliotic patients who are coming in for regular care right now. And yeah, it does help. Correcting pressure from the spine will really help in reducing pain that they may feel. It may help with the development of the scoliosis, and it may help to limit the development of the scoliosis. So again, one more thing, it is very case by case dependent.
But is that you can't correct it, right? It comes in that like
There's different reasons for scoliosis. Some of them are mechanical, some of them are structural, and some of them are functional. Okay.
okay.
So when they're doing certain things, it bends. When they're standing straight, it's fine. But when they bend, it bends, stuff like that. So those are functional scoliosis. Most of the time, there's something called idiopathic scoliosis. And that's like, it has no reason. It's just there. So at the tender age of 10 years old, it's really important that we figure it out correctly, because if it does, like at this point, I'm sure if your daughter is prepubescent, the hormonal changes haven't really kicked in yet, and it may be a good situation to kind of get that on board and get a sort of care routine going from a chiropractic standpoint. Manipulating the spine at this point could actually take pressure and reset the nervous system on how much this develops. But if it's already if it's a fairly deep curve already, it may be a situation that we may need orthopedic intervention. So don't overlook that.
Sure, sure. Another common question is on spondylitis, right? Can people with spondylitis, of course, first question is, do come to a chiropractor? And what are the other daily tips would you give for people with spondylitis? Any workout do's and don'ts? I remember someone recently asking me about when with spondylitis, they're not able to do certain movements, right? They can't do planks because they feel some strain and pain. So tips on that, doc, for spondylitis.
So Shui, this is a really important inflection point, okay? And that is because spondylitis is actually a misnomer in most cases, okay? So I know there was one person who was posting, who was asking a question about ankylosing spondylitis, okay? So spondylitis, as it is, I'm not really good at doing this live spelling and chat stuff, but spondylitis is a more inflammatory arthritis where the joints are actually influenced by biochemical changes in the body. Okay. And that's unfortunately something that most of the orthos in the country throw around. A lot of doctors like, oh, it's just spondylitis, spondylitis, spondylitis. It's actually not spondylitis. It's actually something called spondylosis.
Mm.
Spondylosis is a situation where it's degeneration, it's wear and tear. Now,
Mm.
wear and tear is very fixable. Wear and tear is something that we work on all the time, right? Wear and tear of the joints is like uh, calling your spine spondylitic is saying like you're calling your face degenerative if you have wrinkles, you know?
Mm.
As we age, we're going to be degenerating and the spine will show wear and tear. And that's normal. It happens. There are certain things we can do to accelerate our spondylotic change, or we can do things to reduce that change. So if I'm sitting around and in front of the computer all day, don't do any exercise, eat a crappy diet, you can say that my average rate of degeneration is higher. If I'm exercising, eating well, going to the chiropractor and doing things like yoga or Pilates, I can say that my average rate of degeneration is less. So the answer to the question is depending on whether it is true spondylitis, like if it's ankylosing spondylitis. Ankylosing spondylitis is what we call is a type of inflammatory arthritis where the spine eventually starts to fuse. So we take a lot of our motion for granted. Unfortunately, for ankylosing spondylitis, there is no cure. It is a situation that nobody really, I mean, science has not understood why this happens, but this typically happens to men more than women, aged 25 to 40 in specific. So that's where you first notice these symptoms. There is a blood test that we can send for to diagnose this, and there's certain x-ray findings that we can find this with. Now, if you are suffering from ankylosing spondylitis, one of the things that you definitely need to do is fix your diet. Your diet needs to be an anti-inflammatory diet, which means that all of the stuff that you're putting into your body should be low on your inflammation level, which means low sugars.
Mm.
Sometimes it's even things like, I don't know if you guys have ever heard of something called nightshades. Nightshade vegetables and fruits have a higher degree of inflammation as compared to others. And that includes tomatoes, bananas, eggplant, peppers. And those are some just a small, you can look into this nightshades, and you can also look into the anti-inflammatory diet. Consult a nutritionist. We have a nutritionist on our staff that really is an expert when it comes to the anti-inflammatory diet. But I don't know if you guys know about a group called Imagine Dragons. They're a rock group or whatever. They sang a bunch of popular songs. Remember that song Thunder? Anyway,
Mm.
um, so the lead singer of Imagine Dragons had ankylosing spondylitis, and he was a rock star, and he was, living the party lifestyle, and his body was getting so bad that he couldn't perform on stage anymore. So he changed his diet, he started exercising, and it's really made a huge difference. He still has ankylosing spondylitis, but his functionality has improved by a lot. So first diet, and the next thing is you need to start to improve the extension ability of your body, even if it's limited, even if you can't do too much, keep practicing your extensions because that is the thing that goes first.
Mm. Yeah, got it, Doc. Thank you so much for that. I think spondylitis, spondylosis is a very commonly asked question, and a lot of people avoid, so many different type of workouts. Nobody looks at the nutrition part of it at all. Everyone's avoiding exercise because they feel strain and pain, right? But thanks for putting that whole nutrition angle there because I think really none of us knew about the whole connection to nutrition there. Her, we have a question where of course it's she's talking about why she's asking this question. She's gone through a fall and pain and a whole lot of things, but her question at the bottom was if there is something you can enlighten about the pinching pain in dimples of Venus.
Dimples of Venus. That's a new
Yeah,
one for me. I'm sure she's referring to in the low back,
yeah,
where you
lower
look
back,
into your
yeah.
low back. I've never heard that one before, I'll be honest with you, but I assume. So the dimples of Venus are actually the beginning of something called your SI joint, your sacroiliac joints. It tells us that if you're having pain in those areas, that you're likely sitting for too long, or there is a misalignment at the sacroiliac joint. that is something that is correctable with mechanical correction. It's also correctable with exercise. Now, sometimes mechanically, those joints are restricted and they do require mechanical correction. And that's what we excel at. So
Yeah.
come see us.
Yeah. Can you talk about hunchback and how to get rid of it? Is it possible to get rid of
Absolutely.
it? Can you suggest some
So
posture correction, basically?
absolutely. So when it comes to hunchback, a lot of times what we're talking about is something called the dowager's hump. Okay. And that is something at the C7 level. If you look at even my spine, I'm starting to develop a bit of that. Can you see that right at the top here? And that's only because I'm on my phone way too much. I'm a chiropractor. I should be doing better than that. But the idea is that we're all human beings.
Did you say I'm on my phone way too much?
Oh, I'm on my phone way too much. My wife wants to kill me half the time because I'm always on my phone. So the idea is that I'm conducting a lot of different things. I have a lot of different things on the go. So yeah, I get it. Life
Are
happens.
you saying this? This?
Absolutely, bang on.
Okay.
So
Okay.
there's something
Everybody.
that we got to figure out here, and there's two types of hinge points. Okay, I'm gonna see if I can do this again. Again, I should get a setup where I have a little bit deeper setup. Anyway, so when I'm working on my computer or on my phone, this guy right here sticks out. Okay, that is your C7, and its actual name is vertebra prominens. In Latin, that means prominent vertebra. Okay, so it sticks out. It's supposed to stick out. But when our spine, and this is something, again, we're talking about spondylosis, right? Where your spine is degenerating. My neck is supposed to curve this way. I'm supposed to have my head over my shoulders. So my ear and my shoulder are supposed to be in line, okay? But with degenerative change, with spondylosis, what happens is that spinal curve, a lordosis, it gets reduced. So my spine actually goes straighter, which pushes my head forward. Now, when my head goes forward, vertebra prominens, C7, the seventh cervical vertebra, it sticks out a little bit more. Okay. So this is a very logical situation. You lean forward all the time, you're going to have a hunchback.
Okay. Okay.
So fixing the posture is as we talked about before, okay? Lift the chest, tuck the shoulders a little bit. I don't want you to feel like a Marine. I don't want you to feel like an armed guard, but you should also not be a banana, okay?
Okay. Got it. So posture, like, is there anything else you want to tell a lot of the youngsters, the younger ones who are on this, call about posture?
Yeah.
I mean, it's for all, not just for the youngsters, but I'm just saying
Yeah.
because a lot of the younger ones are more on the phone, I guess. So, yeah, any tips, tricks, Doc?
It's the same as what I told you guys about working
Yeah.
at a desk. Get out of your chair. Okay. Put your phone down, go do something else. Just keep that amount of concentration at half an hour. It's difficult when you're playing PUBG. It's difficult when you're doing Fortnite. It's not easy. The game might last an hour. So if you're always like, it's not really going to work out that well. I had a point. Oh, somebody had mentioned something about a posture corrector belt. Okay. Definitely. It's something that has become extremely popular. People are like, oh, that should be easy. I'll just slide on this posture corrector and I don't have to worry about it.
Yeah.
I don't recommend it because it's like a crutch. It actually makes your muscles weaker. Okay.
Yeah.
Now, when you have a hunched forward position, it means four things. There's four things going on. You can do this because you're more visible here. Point to your pecs, Shui. Yeah. So the pecs are tight. Okay. So you have to stretch pecs.
Stretch.
Okay?
Yeah. Okay.
Stretch. The other thing is that the upper back. So these guys back here, they're weak. They're weak. So what's happening is tight pecs are drawing your shoulders forward and your shoulder blades are coming out to the side. Okay. So you really need to strengthen your upper back. So guys in the gym, I'm looking at you. It's not all about bench press. It's also about rows. Pull the weights back. Allow your shoulder blades to come back. Pull back. Okay. That's going to help you develop those strength between your shoulder blades. Now, two more areas that are going to be affected by this: weak muscles here and tight muscles right back here. Okay. So the easiest way to kind of touch on both of those things is something called a chin tuck. Okay. This is kind of gross. You guys are going to look at this and be like, I don't want to do that. But this is what it looks like. Okay. I'm going to turn to the side here. This is what we call a chin tuck. Okay. So you're sitting nice and tall, straight forward. You're going to push your chin straight back. I'm going to show you my double chin. Okay.
I just did it.
Right.
Okay.
That is a chin tuck, okay? And doing that on a regular basis is a really great way to strengthen these muscles and to stretch these muscles. Initially, it doesn't feel good. Does it feel good?
It feels okay actually right now. Like
In
it
most
feels
cases.
different because I've never done it. So
So it's one of those love-hate exercises, but my recommendation is everybody should be doing those, um, 10 repetitions, hold it back there for 3 to 5 seconds and do that 3 times a day. So 10 reps, 3 to 5 second holds, 3 times a day.
yeah. It just kind of helps you discover a double chin that you thought you never had.
It also helps to strengthen these weak muscles in here that you can't really strengthen any other way.
Yeah, yeah. Thanks, Doc. I think that helps. Yeah,
Mhm.
I know we have a lot of questions. I'm going to try and take a few more, but I wanted to just touch upon one more thing, very
Sure.
important, because a lot of people here, or almost everybody here, exercises, right? Just the importance of, strengthening that muscle mass, improving that muscle mass in the body, and just incorporating strength training, weight training for spine health. Just want you to, quickly talk a little bit about it so that everybody understands the importance of strength training, weight training, resistance training. I mean, it's got so many names.
So in any situation, we're looking at 3 things, especially when we're talking about pain or strengthening. One is the muscle. That's the obvious one. The second is the joint. Okay. And the third thing is the nerve. Okay. We want to have strong information going from brain to body. Okay. The brain controls all your movements. So if your nerve is moving, if your nerve is functioning at its highest capacity, your muscle will function at its highest capacity. Because again, the muscle works with the signal that is coming from the nerve. Okay. So if the muscle is weak, it can affect the joint movement. And if the joint movement gets affected, it can affect the nerve. So that's what's the most important thing. You should remember it. So if you think about the chicken or the egg, right? Which came first? It doesn't really matter because one can affect the other. In this case, nerve, muscle, and joint. So it is a good idea to keep all of those things in good condition. Typically speaking, if you're working out, it's a good thing. You should continue to do it, especially if you are before 50. Like in that 40 to 50 range, you should really, really, really focus on building muscle because after 50, it becomes difficult to put on muscle. Okay, that's just a metabolic thing. But after 50, we should be looking at maintaining muscle mass. So it's important that we continue working out with resistance, with weights.
Got it.
So your working out is going to help you with your joint and your nerve, but you should also pay attention to recovery. You should also pay attention to stretching your muscles, making sure your joints can get that range of motion. If you think about bodybuilding, for example, the guys who are on stage, the girls who are on stage, who are doing the competitions, they're not judged only on size and bulk and symmetry. They're also looking at range of motion. The people who are the most flexible score higher points. So remember that. You want to make sure that your joints can move through a good degree of range of motion.
Yeah, absolutely. I have a very interesting question. Is chiropractic a completely scientific system? Why do you think it's not so popular in India?
Oh, that's a great question. Okay, so this goes back a long way. But okay, first of all, chiropractic has been around for 125 plus years. It hasn't been around in India because it's mostly a Western science. It was popularized in North America, and then it eventually spread to Europe and other places. Now, every culture has their own kind of chiropractic like looking thing. I'm sure some of you guys have heard of Puttur bone setters and other things like that. Bone setting is a really common thing throughout Asia. And yeah, well, it looks similar and you get similar cracking sounds and all those things. It's chiropractic is the first scientifically driven process that's been defined for the spinal manipulation part. So chiropractors are doctors, and we graduate after a 4-year program post grad. So I did a 4-year undergrad followed by a 4-year doctorate. So in the United States, there's about 80,000 chiropractors, and we're the second most numerous doctor profession in the States, right behind medical doctors. Now, it's if you Google chiropractic, the first thing that pops up is the Wikipedia page, and the Wikipedia page calls it a pseudoscientific process, which is complete bollocks. I mean, we're fighting an uphill battle on that. But if you look it up, there is tons and tons and tons of scientific research about the effectiveness of chiropractic and what we're actually after, what we actually do. In the initial stages of chiropractic, where we were in our infancy 125 years ago, the American Medical Association actually tried to squash us out with an antitrust suit and all that stuff. They eventually lost, and that's why medical doctors today still find us or still try to consider us pseudoscientific. But it's a very scientific process. We have a lot of training in radiology, in anatomy, and in terms of like what each part of the body does, which muscles are affected, which nerves are affected, and all of those things. So to answer your question in a very long way, it is scientific. We do train a lot, and this is something that you can't just watch a video for and learn.
Yeah. Another very asked, sleep ergonomics. Can sleeping posture affect neck and back?
It can. If you're sleeping on a really soft surface, for example, your low back will more than likely hurt. If you're sleeping without a pillow, I don't recommend that. I do recommend that people do sleep with a pillow. If you are having low back pain, sleeping with a pillow underneath your knees is a great idea. If you're a side sleeper, a pillow between the knees is a good idea as well. Some people prefer those cervical contour pillows. Those are fine. Finding a pillow that works for you is very, very personal. There's no blanket statement that I can say, yes, this pillow and this, mattress and whatever. I can say that Duroflex mattresses are the only orthopedically certified mattresses in India. That's from the National Health Academy. Everybody else is just kind of throwing orthopedic down as a marketing term. But yeah, and when it comes to the pillow that you're using, if you are comfortable with the contour pillow, that's cool. Memory foam is also fine, but it's just one of those things that
someone with back can place a pillow under the knee, and someone with a side sleeper can place the pillow between their knees.
Yes, and behind the quality of our practitioners. So you should come see us with confidence. If you have questions about other practitioners in and around who are, maybe claiming to be chiropractors, we can help sort you out with whether they are official chiropractors certified or they are not. So whatever the case is, we're here to help. Chiropractic is a great healthcare choice, and I am happy to help with whatever I can. Thanks again for having me.
Thank you so much, Doc. Thanks very much. Yeah, thanks,
Take care,
Raj. Have
Shway.
a great day. Thanks, Alish. Yeah, I'll connect with you, Doc. Thank you so much for your
Absolutely. See you guys soon.